Folks say they find the NHS hard to understand as patients and relatives. Try being a member of staff. I work with people who have got mental health problems living in the community. Not just a spot of depression, but the really hardcore stuff, the severe and enduring. When people think about mental ill health, they either think about their own reference points of anxieties in life, or people that are admitted to a psychiatric hospital under the Mental Health Act, being sectioned, we call it. But in reality, very few people are sectioned because we do our utmost to prevent that. Mind you, if someone is sectioned under a treatment act, like a Section 3, there's actually a legal requirement that when they are discharged, any ongoing care in relation to their mental health needs are funded. A 117, they call it. I didn't really understand it until recently. It was just a label we gave, and, well, we were grateful that we didn't have to jump through the hoop of financial assessment, especially if people were self-funders and they didn't believe that they needed care. 2 weeks ago, my manager asked me to go to this new panel and present one of my 117 patients. Let's call him John. And I remember thinking, what new torture is this? I had these 2 forms to fill in, and again thinking, what tick box nonsense is this? So, to be honest with you, I did the bare minimum. Well, I nearly shot myself in the foot though, didn't I? Because when I arrived, I could tell that this wasn't going to be a walk in the park, despite the smiles and the welcome. The chair introduced everyone and explained why they'd set this process up, to ensure commissioning oversight to the quality of packages and who was going to be responsible for the money. I didn't realise that both the council and the NHS have statutory duties. But then, the focus was all on John. They asked really searching questions, so it's a good job I know him well. John is 34, and he has a diagnosis of paranoid schizophrenia, along with mental and behavioural disorders, and that's due to polysubstance misuse. He was discharged from our inpatient mental health unit at Kendry Hospital, Barnsley, about 3 years ago now, having spent 6 months with us. And to be honest, he's bounced from pillar to post. It was okay to start with, but then he got involved with drugs again. He was evicted twice, and he faced criminal charges, which resulted in him being remanded. Here's the irony. Since prison, John hasn't touched substances for over 3 months. Mind you, he is on a suspended sentence and under a drug treatment order. He's still troubled by his voices and the negative symptoms of mental health. And the view was that this time we needed to do all that we could to prevent a relapse. His abstinence of drugs and his compliance with treatment, with medication and our support, meant that this supported living setting agreed to take him. Took some persuasion, mind, but already I can see a positive change in him. Because of his illness and his chaotic lifestyle, his living and social skills are very basic. So we're working to develop his activities in daily living. So his cooking, his shopping, his budgeting, maintaining concordance with medication, and giving him a structure to his daily life around more social acceptable contexts. which has actually reduced his vulnerability, especially out in the community. And it also helps that he's in a different place from his old haunts. He's re-established contact with his family, and his brother comes to visit him at least once a week. I began to get worried that him doing well would count against him, that this panel would reduce his package. I mean, he only gets 14 hours a week anyway, plus our input from assertive outreach. But they seemed to get that we needed to stop the revolving door decline that was going on, and that it was early days. So they asked what the outcomes of the plan were. Was it a recovery focus, or was it just maintenance of John's current mental state? They asked about the risks and about how we'd planned for that and how they'd been managed. They asked loads of questions. In fact, they were just as interested in John's physical health as his mental health. John's had really bad leg infections in the past. They're okay now, thankfully. But the panel said, they suggested that why don't we make a referral to the district nurse team so that they could advise him on how to take care of them, plus a steer in the eating healthier zone. But first, he needed some new teeth. He'd lost all of his teeth because of the drugs and not taking care of them. So they suggested that he registered with a dentist. Well, that's another story though. I also mentioned that there'd been a real problem with lack of communication from John leaving prison. And one of the nurses on the panel said that, well, if you give me the information, then I can pick it up with NHS England. And then at the end, the chair asked me how I'd found it. And I had to be honest. I said, well, I was expecting something like Dragon's Den. But, I said, I think you actually got who John is and what he needs. And you've actually given me some pointers. They thanked me and then said, spread the word. So, here I am.